And switching topics, there's no question that as the body ages, it changes. For many, change in their vision may seem like a normal part of the aging process.
But some changes in vision can lead to blindness if not caught early. So we reached out to a doctor who had tips on what we all should be doing to prevent it.
Today we're going to learn more about something called wet AMD. Now the reason? Well, nearly 11 million Americans live with a condition that destroys the part of the eye that provides sharp central vision and a leading cause of vision loss in people age 50 and older. The good news is that wet AMD is treatable. Dr. Michael Cooney has spent his career helping patients maximize their eye health and maintain good vision as they age, and he joins us this morning. Doctor, we are kind of talking about people that, are going into their 50s and beyond. How can somebody distinguish between maybe just normal eye changes that come along with that or something that's a real serious condition?
Well, good morning, Tina. And you start out with a very good and important question. The simple answer is people cannot tell what is a significant eye problem or what might be something that's insignificant, just like needing glasses or reading glasses. So the single take-home message here today that's most important for your listeners is that every patient after the age of 50 or anybody having a change in vision really should get in to see their ophthalmologist on an annual basis for a full dilated eye examination to be screened for a whole host of different eye conditions, including macular degeneration, which is the key topic we're here to talk about today.
And that's what I kind of hit on at the beginning, this wet AMD. I know you have more of a medical term for this for us and what that really means for a person that may be affected with it.
Yeah, so you correctly said macular degeneration is the leading cause of vision loss in people over age 50 in America. 10 million people have it now. Over the next 10 years, as the baby boomers age, it's going to double to about 20 million. So it's a rising public health problem. What it is, Tina, is the retina is the part of the eye that's responsible for for producing vision. It's like the film of a camera, and the macula is the part that's most sensitive for producing your straight ahead vision. So reading, seeing faces, watching TV. And in wet macular degeneration, what happens is suddenly a little blood vessel starts to grow in that area, which can cause a very rapid and abrupt loss of vision over the course of weeks to months, leading to a permanent scar and permanent loss of your straight ahead vision very quickly. The good news is, however, there is an effective treatment for this, which can stabilize this condition and has really revolutionized our ability to treat wet macular degeneration.
So once we do, go in, we're diagnosed that this is something that we're affected with. Is there symptoms that could lead us to go in to get checked for this? And then once we are, we say, okay, this is exactly what I'm dealing with. What is it that we can do to do the preventative treatment leading up to that?
So the most common type of macular degeneration, which we didn't talk about, is what's called the dry form, which is where little aging changes just accumulate in that area of the macula. And in those patients, oftentimes they have no symptoms whatsoever, so they really need to be told that they have it. Only way to know is to be dilated and have a doctor tell you. Symptoms of wet macular degeneration, however, are somewhat different. So if you suddenly have things that are normally straight start to become wavy or distorted, like a straight line becomes distorted, or you have a new blank spot in the straight ahead part of your vision, those are all signs of something new, like a little blood vessel or wet macular degeneration may have started, and you really need to get in promptly to see your ophthalmologist so you can be started on treatment. The good news, as I mentioned, is there is a treatment for this. One of the first medications approved for wet macular degeneration is a drug called Lucentis, which is highly effective in stabilizing those blood vessels, stopping them in their tracks, and preserving vision in upwards of 95% of patients. And in about 40% of patients, we can actually improve vision, which up until we had these medications, Tina, that was unheard of. Like any medication, patients need to check with their doctor to be sure that these medicines are right for them. And if they are started on Lucentis treatment, they really need continuous follow-up on a regular basis for regular treatments to keep this condition stabilized.
Well, I'm always amazed at where the medical field is going and the new things that are coming out as we move into the future. Now, if somebody needs more information on preventative measures or what we can do, and of course this treatment that is now available, where can we get that?
Tina, there's a great website, preventblindness.org, which has a wealth of additional information on this topic, as well as other eye-related conditions.
Well, Doctor, thank you again so much for stopping in with us this morning.
Thank you, Tina, for having me.
Don't go anywhere. The Morning Blend will be right back.